And we're able to distill that, and we're able to apply that specifically to an individual patient's circumstances and situation. So how can artificial intelligence or AI be used to assist clinicians in delivering quality care to their patients? I think the first and the lowest hanging fruit in this area, if you would be around clinical decision-making aids and tools. So one of the things that I say as a healthcare provider, as a former academic, as somebody that's still in and out of the clinic every now and then, one of the things that I say, and I mentioned this in the book, Better Outcomes, A Guide to Humanizing Healthcare, is that the real value that healthcare providers bring to the table in any patient engagement or any patient encounter is the ability to take the vast array of technical knowledge, the very vast, broad amount of information that's out there from a technical perspective, the science, the research, the literature, clinical protocols, and we're able to distill that, and we're able to apply that specifically to an individual patient's circumstances and situation. One of the great benefits that I see in artificial intelligence is the ability to make that decision-making much more effective from an accuracy standpoint. So think about maybe a clinician who's seen 10, 15, 20, 30 or 40 patients in a given shift, depending on how long the shift is. They're tired, they're at the end of their rope, and they get a complex patient that comes in that maybe has multiple comorbidities or just complicating factors, maybe psychosocially at work or at home, and where it would be very easy to come up with a general treatment plan based on what we know from the literature and what might address the main symptoms in this patient. There might be something that we miss because of either a comorbidity or something that maybe there's a obscure article or a piece of literature or research that would be applicable to this patient. We just haven't gotten there yet because we don't have the time, right? Right? Artificial intelligence has the ability to really bring some of that information into the clinical decision-making process. So perhaps as a dashboard, perhaps as a clinical decision-making aid or tool in an EMR or something like that, where the clinician is filling out the treatment plan or the assessment, and they get a prompt that says, should you be considered or considering XYZ, this specific patient factor, maybe linked to a couple articles or some of the references, maybe this is something we need to consider. So that's one of the areas where I feel like artificial intelligence can be hugely beneficial to clinicians in the clinic facing a patient, trying to develop a treatment plan or a treatment program that fits that specific patient's individual circumstances and all of the situations going on that are specific to them, as opposed to what's broadly available because of their diagnosis or their symptoms or their presentation. Artificial intelligence can help us really root down and get down to, again, more specific healthcare delivery. And then the other piece is accuracy in diagnostics, right? So maybe it's an algorithmic piece of software. We had somebody on the Better Outcomes show on the podcast talking about using artificial intelligence and algorithmic learning to improve the accuracy of cardiology diagnostics, imaging studies. So things like that are really exciting. Like, how many times has somebody had some kind of treatment go awry or not delivered at all, or they were missed because some tiny little nuance didn't get picked up by the clinician that was reviewing the reports, and not because the clinician was incompetent, but maybe the clinician just saw 200 reports that day and they're going through and trying to do the best they can. Artificial intelligence, if it could screen those imaging studies or those diagnostic tests and just kind of highlight, maybe put a little flag for the clinician that's reviewing them, look at this in a little bit more in depth, or look at that a little bit more in depth, could really catch some of those potential mistakes that can have real implications for our patients. So those are just two big ways that I can see artificial intelligence helping clinicians deliver a higher quality of care to their patients. The individualized care piece, so being able to take all that technical knowledge, the research, the protocols, and individualize it for a specific patient, and then the ability just to improve accuracy overall.